Interpersonal communication in healthcare. 52% of healthcare organizations experience communication issues that negatively impact the patients on a daily or weekly basis. This is primarily due to insufficient communication skills. One study defines interpersonal communication in healthcare as the ability of the provider to elicit and understand patient concerns, to explain healthcare issues, and to engage in shared decision-making if desired. Communication can occur across three main channels: written, spoken, and online. In written communication, notes are especially important for sharing information between healthcare professionals. Spoken communication is primarily verbal between healthcare professionals and patients. Online communication is becoming more popular with new technology which allows healthcare professionals to communicate with colleagues and patients digitally. It is important for healthcare professionals to have a wide variety of interpersonal skills. These include active listening skills, which help professionals gather pertinent information from patients and colleagues. Emphasizing the person calms the patient and allows for better healthcare results. This allows the patient to feel valued as a person and involved in determining the course of his or her treatment. Clarity is important because healthcare professionals cannot afford to be mistaken about a patient's diagnosis. Also, ambiguous messages leave the patient feeling uneasy. Body language can send several messages, so health professionals must regulate body language or they risk upsetting the patient. An example of these skills in action might resemble a situation in which, because of his active listening skills, a doctor recognizes that a patient has been having cancer-like symptoms. The doctor did not miss this information because he was listening attentively. Rather than worrying the patient with anxious body language, the doctor regulates his body language so that he gives off a calm and collected appearance. This way, he is able to consult the patient and deliver the difficult information calmly. He can deliver this information by emphasizing the person. He can put the patient's needs above all else and consult them on their opinions on treatment plans. This will allow them to feel as if they have control over treatment, and this in turn will give them confidence and assurance in the doctor's plans. These communication skills are important for professionals to maintain because they are faced with communication barriers. Communication barriers in healthcare include grief, pain, anxiety, medication, different personalities, and a patient's condition. These are all factors that can block the messages healthcare professionals are trying to communicate. There are several benefits of communication in healthcare. These include higher patient satisfaction, improved adherence to treatments, reduction in psychological effects such as depression and anxiety, and increased patient confidence or self-efficacy. Other benefits include symptom reduction, improved quality of life, increased survival rate, and stress and burnout reduced for healthcare professionals. Consequences of poor communication include preventable medical errors, stress and burnout, and even, in the worst cases, death. Ultimately, communication is one of the most important skills a healthcare professional needs in order to do their job.